Hello, Dr. Leah here with some important information for you and your family. These days, most of us have at least one member of our family or close friends who have been affected by Alzheimer's disease. That's no surprise, given that neurodegenerative diseases of all types are increasing at an alarming rate. There are now an estimated 5.4 million Americans aged 65 years and older with Alzheimer's disease, and this number is expected to almost triple by 2050 as the population ages. Alzheimer's has become the 6th leading cause of death in the United States and the 5th leading cause of death among Americans aged 65 years and older, which is concerning because more than 20% of Americans will be over age 65 by the year 2030. So it's important to do all you can to reduce your risk of this serious and in many ways heartbreaking disease. Alzheimer's disease is a disorder involving degeneration of the brain which causes progressive mental deterioration, loss of memory and cognitive functions, and inability to carry out activities of daily life. Anyone who's been around advanced Alzheimer's knows how crippling this disease can be. There are numerous studies extensively researching the underlying causes of Alzheimer's, and we know genetics plays a role, but like most chronic degenerative diseases, environmental factors are a major contributor. So here are 3 things you can do today to reduce your risk of Alzheimer's disease and dementia. Number 1, avoid heavy metals, especially aluminum. Aluminum is the cofactor along with tau filament in the formation of neurofibrillary tangles. Those with Alzheimer's disease have been shown to have significantly higher aluminum levels than both normal people with no disease and patients with other types of dementia. Although it may be impossible to completely avoid ingestion of aluminum because small amounts are naturally occurring in drinking water and some foods, it's definitely worth avoiding whenever possible. Some sources of aluminum include certain antacids like Tums, aluminum-containing antiperspirants, aluminum pots and pans, aluminum foil, and non-dairy creamers. Aluminum is also found in baking powder and table salt as an added ingredient to reduce lumps. Supplementing with the mineral magnesium can reduce aluminum absorption because magnesium competes with aluminum for absorption in the intestines and at the blood-brain barrier. Some vegetables, whole grains, nuts, and seeds are all good sources of magnesium. The second way to reduce your Alzheimer's risk is exercise. Numerous studies are coming out showing that the most important thing you can do to improve your mental function and prevent Alzheimer's and dementia is exercise. When you think about why, it makes sense. Exercise increases blood flow, and blood flow is how the body transports good nutrients and oxygen into cells and transports toxic byproducts of metabolism out of cells. More physical activity means more good stuff into the brain and more bad stuff out. Physical activity also increases the development of new blood vessels in the brain, even in old age. Not to mention, exercise has obvious benefits for normalizing blood pressure and blood sugar and cholesterol, all of which are risk factors for Alzheimer's disease at elevated levels. Studies show that adults who are more physically active have less brain atrophy and better cognitive function as they age. Nearly all types of exercise are beneficial. Aerobic exercise, resistance training, stretching, toning, and range of motion exercises all yield cognitive benefits in older adults. So get out there and move. The third way to decrease Alzheimer's risk is to increase your antioxidant intake, both in your diet and as supplements. There's considerable evidence that increased oxidative damage plays a central role in the development of Alzheimer's. Antioxidants mitigate this damage and may act as a powerful preventative medicine. Vitamin C and vitamin E in particular have been shown to slow the damaging effects of oxidation in the brain. Zinc may also be beneficial because it's required by many antioxidant enzymes, including superoxide dismutase, to be fully effective. Foods that are rich in antioxidants include brightly colored fresh fruits and vegetables. It's also important to avoid substances that cause more oxidation and cellular damage, like cigarette smoke, alcohol, and even certain medications, as they increase the likelihood of cognitive decline. Following these 3 tips can help you and your family lower your risk of Alzheimer's disease and stay active and present as you age. Thanks for tuning in today. Until next time, be well.